Hey everyone, welcome to this edition of Potomac Local Live. I am Uriah Kaiser, I'm the publisher of Potomac Local News, and joining us today, and as we continue our conversation about life in a post-pandemic world, is Dr. Christopher Newman. He is the Senior Vice President and Chief Operating Officer and Chief Medical Officer at Mary Washington Healthcare in Fredericksburg. It's a long title that you have there, but we certainly we will have. It's a pleasure for us that you could come on and talk with us, Doctor, about life in the post-pandemic world. You know, we're in phase 3 now. We're moving to some sense of normalcy, but more than anything, you folks have been on the front lines fighting this COVID outbreak. Where are we now? Can you summarize what you're seeing and how far we've come?
Yeah, first I want to just challenge the concept a little bit of post-pandemic. I think we would really like to be post-pandemic. We're all ready to be there. But as we see what's going on across the nation and even various places in the Commonwealth right now, we can see that the virus is not necessarily done with us. And when we let down our guard a little bit, we do have to be careful, as the virus can rapidly increase again. I think we've been lucky in our region at this point that the numbers have been significantly decreased, but we remain hypervigilant, and many of the safety precautions that we've taken and the changes to our operations during the pandemic, we are continuing at this point.
And can you talk about how the operations at your two hospitals in the region, at Mary Washington Hospital and Stafford Hospital, how things are different now than they were back in January? What are some of the things that people will see as soon as they walk into the hospital, and some of the things they may not see when they walk in?
Yeah. So I think everything that we've done operationally has been surrounding safety. Safety for our associates, safety for our healthcare providers, and safety for our patients and visitors. So some of the things that people will see that will be different, typically hospitals have just been open facilities where people are able to come and go down to the hospital cafeteria, go visit loved ones. But at this point, we have universal masking throughout all our facilities for patients, guests, and all of our associates and healthcare providers. We have safety checkpoints as you enter the building, where everyone is screened for signs and symptoms of COVID, and we'll have a temperature check. So that is certainly something that's very different. Hospitals have always been very clean places to begin with, but we've upped our game on cleaning, and we're hypervigilant about cleaning processes. Not only just surface area cleaning, but a lot goes along with air filtration, negative pressure, HEPA filtration, so that we ensure that the air is clean within our facilities and isolated on our cohorted COVID units. Because so much of this disease is really transmitted through respiratory and through air.
So we are seeing that the cases in Northern Virginia especially are down. Hospitalizations are down. We're seeing some increases in other parts of the state, especially the eastern part of the state. So we are live. We are on YouTube. We do have a chat. If you have questions for us that are hospital related, that are COVID related, please put them in the chat. And we may ask them of the good doctor here. You mentioned that the hospital is a public place, and in addition to receiving medical care, that's also I was at a meeting earlier this month at Stafford Hospital in the conference center. And so you have more than just healthcare going on at these hospitals. Is this something that people will be able to look forward to sort of getting back to normal in terms of having business meetings and organizational meetings? Is the hospital the safest place to hold your meeting?
Well, I would say the hospital is probably one of the safest public places around. We know how to handle these kind of infections and these kind of pathogens, everything from our preparedness for Ebola several years ago to now this current pandemic. But that being said, I think we're a ways away from being able to get back to conferences and in-person meetings. When we do have in-person meetings, we have to continue to look at social distancing, mask wearing, how many people can safely be in any given room at any given time. And a lot of that goes with airflow and, because again, this virus can suspend in the air for a period of time if somebody is an asymptomatic carrier. So we do have to be cautious about that. But as a non-for-profit health system, not during this pandemic, but at all times, we do more than just care for patients, in our facilities. We do really look to be an asset to the community, and we've partnered closely with the Department of Health during this and other businesses who've come to us for advice on how they can get back to close to semblance of normal as they can.
Can you talk to me about what is the mood in the COVID ward? I know we talked with doctors back in the spring and the onset when things were very uncertain or had more questions than we had answers, and we still have more questions probably than we have answers. But the mood there was very hectic. Some of the doctors I talked to, showered before they left. They didn't wear their clothes back when they went home. They let them outside. What is the mood there at the hospital for those who are on the front lines?
The mood is very good. I've just been continuously impressed by our medical staff and our nurses who've been on the front lines. I think a lot of the fear is starting to go away. We've really learned on how to keep people safe. And it's been quite a long time since we've had an associate or a physician catch COVID from a patient. So we really understand how this disease is transmitted. A lot of the fear is going away, but we have to be hyper vigilant when we're on these units. I do think there's a bit of fatigue, with our nurses and docs and respiratory therapists and others that are dealing with this day in and day out. But in general, I think the mood is very good. A lot of the fear is going away. And again, I'm just so impressed by those who are dedicating themselves to the care of these patients.
You talk about the fear that is going away. We're still seeing a certain amount of fear when it comes to back to school. We've spent a lot of time here at Potomac Local these past 2 weeks reporting on the decisions of local jurisdictions and their plans to send students back, whether in a hybrid model or with in-school learning and then at-home learning and virtual, going at least for the first few weeks virtually. We're people like you who work on the front lines of our healthcare system. Were you ever consulted about this? Have you ever provided advice to these jurisdictions in the Fredericksburg region and here in Virginia that are trying to figure out what it is they want to do?
Yeah, on an informal basis, and some of the schools on a formal basis, people have reached out and gotten advice on how to do this safely. I think the things that are working in favor of students returning again is that the disease does not appear to affect our children very seriously. It's never a zero risk, but it's a low risk for younger children. I think as people get into high school and college aged, that can start changing. And then the ability to transmit. It does appear that some children have a lower chance of transmitting to others and adults. And, that's always, we worry about our children in the schools, but we also worry about the teachers and the staff and the children coming home where they may have vulnerable folks at home. So there is a bit of uncertainty still with this. We are looking at other countries that have preceded us, and we're not seeing a large surge of transmission from children who are going to school to adults. But I do understand the concerns and the fears, and they are real.
And what should parents be concerned about for those who are sending their kids back to school at least a few days a week? What are some of the precautions medically that they should be cognizant of as students, some go back?
Yeah, I think what we have right now, the only two things that we have right now in lieu of a vaccine is social distancing and masking. So I think universal masking, although that is become this controversial issue for whatever reason, from a public health perspective, that's one of the best things we can do to keep the virus tamped down. So I think masking and then, social distancing, that's very difficult. I'm a father of 4 young children myself. And, we have to understand realistically how you can keep children socially distanced, but I think the schools have to try to manage that. I think some of the contact sports, some of those kind of things may be a little bit difficult to proceed with going forward until we begin to learn a little bit more about the actual risks for younger people with this virus. But at this point, I think it really comes down to just masking and social distancing in learning situations.
We've heard the president talk about his Project Warp Speed, about getting a vaccination, on the fast track. We've heard Britain's prime minister say that that country plans to be done with the coronavirus by the middle of 2021. Both of those, is that feasible? Is that possible that we may see a vaccination between now and next summer within the year? And if so, when it comes down to the local level, how will that be administered? And then what are the challenges on your part to get that vaccine out to people?
Yeah. There's so many unknowns still. The bit of optimism I have is there's so many people across the world working at this, and a lot of the regulatory challenges and hurdles in bringing something like this to market rapidly have been reduced, given how serious this is. What I want to see when, as this starts coming out and we start seeing some possible vaccines coming about is the safety. How has this been tested? And then the efficacy. Does it really work, and for how long will it work? But beyond the scientific challenges, I think as we're seeing in supply chain, even with something simply like getting masks, the supply chain issues and the manufacturing issues of literally getting billions of vaccines available for the worldwide population and distributing that, I think there's going to be a lot of challenges to that and getting that widely in use by next year. So I think there's going to be a focus probably first on getting healthcare providers and the most vulnerable, those over the age of 70 with pre-existing conditions, vaccinated. And for healthier or younger folks, it may be a year and a half or more before we have widespread vaccination. But I think that's it. You really want to look at the safety and efficacy and make sure it's really been looked at closely. And then it's really the manufacturing distribution.
As we continue to move forward in phase 3, I imagine you've been in close contact with officials in Richmond, with the governor's office. What are some of the things I guess people need to be aware of to ensure that we don't go backwards? We keep moving forward in this reopening and in hopes that the economy recovers, that people can go back to work in some capacity, as children will go back to school in some capacity. What do people need to be focused on?
Well, really, the danger point really comes down to congregate settings, crowds of people, indoors. I think those are the high risk. And so much of our life revolves around those kind of situations. I look at just indoor bars and restaurants as such a normal part of our life, but those are probably very high risk situations. I think air travel is something that we continue to struggle with, and the safety of air travel, and that affects many businesses as people do business across the country or the world. But the general concept is really wear a mask, always wear a mask when indoors and around others. Limit crowds or the number of people that you're physically around. And then outdoors is always going to be safer than indoors just because of the air ventilation. And I think over time, if this is with us for a while, when we look at indoor situations, just as we look at the hospital, we have negative airflow, we have HEPA filtration systems. Maybe some of those kind of things are going to be built into all buildings and office buildings going forward as a way to clear pathogens and viruses from the air. But I think, when businesses open, there are safe ways to do it, but certain things that we're used to doing, like anything involving crowds, from festivals to concerts to those kind of things, and even worship, church services, have to be very cautious around getting a crowd of people inside. So I think outdoors, socially distanced and masked is the way that we can quickly get our economy back and keep this from flaring back up on us again.
We are seeing some rapid changes in the way people are working, and we're seeing people leaving cities and actually moving into rural areas, into the suburban areas and even rural areas. And as Mary Washington looks out to 5, 10 years from now in terms of how it's going to serve the community, a changing community, um, a growing community because of its proximity to Washington, D.C. But as the needs of the workforce change, and if we're doing more working from home and no longer need to go to that Washington, D.C. office, um, have you guys given any thought to how that might change the way you deliver service?
Yeah. We're already seeing the housing market explode here in our local region. I was talking to some local realtors, and it's very hard to keep things on the market. And a lot of people are already moving to DC as they start thinking of moving from DC as they start thinking about these kind of situations. I think one thing, the telehealth and the video platforms, as we're talking right now, we're going to be seeing more and more of us reaching out to patients, providing care where they live in their homes, and less of the patients coming to us for care. So I think you're going to see at-home monitoring especially for those with chronic diseases, and frequent check-ins through a telehealth platform where we're able to check in on people and provide enhanced care at people's homes. So I think that's one thing that we'll see coming out of the technology and coming out of this pandemic. The work from home, we are looking at that, and our healthcare providers or nurses or doctors obviously have to come to the facilities, but just like any other businesses, we have marketing and IT and accounting and finance and a lot of those support services that occur in office buildings. And many of those individuals are working from home at this point. And we've been monitoring productivity, and productivity has been very, very good. But in the long haul setting, how do we start safely bringing those folks back? And what are the long-term outcomes of people working from home? How does it affect your culture? How does it affect creativity, ability to train, ability to onboard new providers or new people coming in, new associates, and the lack of fellowship and camaraderie and team building when you're only virtual. So I think there is going to be a downside, and I think in the short term here, it's been very successful having folks work from home. But I think in the long term, I don't know if we're going to be able to just do that. And when we design new offices, we are going to be thinking about, are people going to be crammed in these cubicles, an open office environment? No, we'll probably be designing our offices in a different way, where there's some spacing and there is some of those kind of parameters come in place.
At the onset of this in March, I think the federal officials looked over to Europe, and they looked at, especially in Italy, and they saw people who were in the hallways that could not get on a ventilator. And it really struck fear in a lot of the federal officials who had to come up with a plan to deal with this. Now, we haven't seen that anywhere in the US. We haven't, especially here in Virginia, we have not seen that. So one would say that could give you some hope about this and about this virus and its lessened impact that it has had on it has not been as bad as we had feared it would be. So, Doctor, I'm going to ask you to give us some more hope out there. With what makes you hopeful based on what you've seen and where we're headed through this pandemic?
Yeah, I think the ingenuity of the human spirit. I mean, I think we are going to rapidly see treatments and vaccines, come really to our patients more rapidly than we've ever seen with any disease process in the history of mankind. So I do have great optimism about how ingenuity and a crisis can bring people together, and how rapidly scientists can come up with solutions for all of us. So I do think there is going to be a vaccine or treatment within the next year or so. But what we did learn from Europe and some of the early cases is that, again, you can't let down your guard. We had the opportunity of having several weeks lead time, and we were able to socially distance, and we were able to put some precautionary measures. But as we're seeing, even in parts of this country right now, such as Texas and Florida, and even in Eastern Virginia, this can get out of hand very, very rapidly. When we look at the prevalence in our local community, we've only had about 1 to 2% of our population that's had COVID. So we're nowhere near herd immunity. There are still a lot of people that could catch this that don't have immunity for it. So I just fear, I know there's some people are very tired of this and they want to get back to the old way of living. Personally, I am as well. But we do have to be a little cautious. We do have to get to what we're calling here, people are calling it the new normal, but we're here calling it the new different. And until that vaccine comes out or until there is a effective treatment, we do have to be a little cautious.
Well, do you, so those who haven't had a test and those who want tests, can you walk us through that process? I know we could go ahead and a body test and I, is suspecting that I may have had it at some point and that came back negative. So I'm not going to get on a plane. I thought I might take a cheap Hawaiian vacation here soon, but that's not happening.
Yeah.
But for those who need testing still, can you walk us through the process?
Yeah, so we do have multiple areas, including at Stafford and here in Fredericksburg, where we have outpatient drive-through testing sites. And right now, and that's the swab type test where you're tested for active COVID. We are currently using commercial labs for those, and the turnaround time had been in the 2 to 4 day range. But as we've seen the supply chain overwhelmed across the United States again, we're starting to see longer turnaround times for testing. Because what's happening in Arizona and Florida and Texas is going to affect us here in Virginia. So we're hearing to expect up to 10 to 14 day turnaround times for testing yet again, like we had back when this all started. So we're watching that very closely. We've very rapidly worked to build up our in-house testing capability through our laboratories here at the hospital. And we do have several pieces of equipment internally that we're able to run rapid tests. But right now we only have the volume to be able to test inpatients, people who are sick here in the hospital, and get a result in anywhere from 2 to 4 hours on a patient. So we know how we can start, treatments such as remdesivir or convalescent serum, or a lot of these, trials that are going on for specific to COVID. So testing, we're not out of the woods on testing, but people can get tested. We do have these outpatient testing centers, but we may be challenged again on the turnaround times.
Well, Dr. Christopher Newman is the Senior VP and COO and the Chief Medical Officer of Mary Washington Healthcare. I do like saying your title. It's very it's very informative. But again, sir, thank you for taking time out of your day to share your thoughts, give us a little bit of hope and some direction as Virginia continues to progress in phase 3, and the number of hospitalizations and cases overall continue to trend downward. And that's where we hope that
yes.
it stays. Absolutely. All right, folks, coming up at 2:30 today, you can join us live. Dr. Bob Schneider of OmniRide, that is a transportation service that services Prince William counties, Manassas Park, and Stafford County, will be on with us to talk about how it is moving forward in this the post-pandemic world and serving its customers on buses, albeit, I guess, socially distanced seating as we understand it. But they'll be on with us at 2:30 today, and we hope to see you then.
Great. Thank you.
All right, sir. Thank you so much. We are done. Thank you. Have a good one.
Bye-bye.